Dear friends, hello, welcome. On behalf of the board and our executive secretary, Dorley, and her wonderful team, I would like to extend a very, very warm welcome to all of you here to Gastein. And to be frank and honest, we are so honored that you are here and that you are spending your precious time with us and with our topics. Friends, I don't want to disconcert you, but this year's European Health Forum Gastein is a very serious conference at a very serious time. The sands of health are shifting. Why? Because democracies are under siege. The demographics of Europe are changing rapidly due to aging, but also due to migration and urbanization. And digitalization remains a major game changer in how health services will be delivered and science will be conducted. Well, you might ask, what does the health sector, the world of health policies, our world here in the European Health Forum, have to do with the fact that many of the European democracies are under siege? Our goal is to ensure that by the end of the conference, we all have a much clearer picture and understanding of the urgent need for action, not only to deliver what is necessary, but also to bring about what is imaginable. The health and nursing sector is one of the focal points in the debate regarding the shifting sands in our democracies. To begin with, there's a very pragmatic reason to tackle these issues. Publicly financed, high-quality public health services need a strong fiscal base. They comprise, on average, a good 10% of the national GDPs. Therefore, the costs of health systems represent one of the largest items in public budgets. But let's not forget that public budgets are based on political decisions that are politically by their nature. They can therefore be changed and are highly dependent on the political climate on which they are decided. The necessary green transformation of our economies, the increasing costs of natural catastrophes, the costs of new wars, armed defense, all of which are budget items to which many of us didn't pay all too much attention until recently. The fiscal costs of migration and integration, all these expenses are already taking ever larger pieces of the public budget pie, which by its very nature cannot be endlessly expended. And that trend will become even more pronounced in the years ahead. So we in the health sector should not by any means be overly confident about the stability of public funding for health services, long-term care, and investments in new research and developments. Politics can change the funding, and in some instances is already cutting public health budgets to meet other budgetary necessities. We here in Gastein, the community of the European Health Forum, must call for a new social contract, a new political commitment to health and well-being, a renewal of our deeply rooted understanding of solidarity and the social codes which so fundamentally changed our thinking about social justice in the last 70 or so years. But low quality of health services or long-term care because of a lack of financial resources is one of the elements in public debates that further undermines public trust in the functionality of democratic institutions. These shortcomings are further waters for the mills of left and right-wing extremists and populists of all sorts. So let us start this call for a new social contract to safeguard not just the financial needs of well-functioning healthcare systems. This is only one item on the list. We must also incorporate the elements of mutual trust within the systems. That means we must be committed to preventing the cost drivers in our healthcare systems for overstretching available funding when it comes to new innovations and therapies and technologies. A new social contract of this type would not be complete without commitments from the pharma and health tech industry as well. And the third cluster of contractual partners in such a new political commitment comprises all the industry directly contributing to the cost of healthcare systems. I'm referring here to the commercial determinants of health, especially the determining factors for commercially induced diseases. I'm talking about the political commitment to have the food and beverage industry, big agribusiness, all the producers of toxic chemicals and other pollutants pay their share of the healthcare costs for which they are directly and indirectly responsible. Whoever threatens health or even kills people must pay a high price for it. Friends, let me be personally very clear. I am sometimes very tired of discussions that we must stop right and left-wing extremists and populists because they pose a threat to our democracies. Yes, of course, they are dangerous, and they do pose a threat. But this claim alone will not stop them from gaining the support of the electorate. We, the leaders of our health systems and health policies, must recognize that the success of populist movements depends not only how we act, on how the political center acts to solve the burning issues of our time. No, the rise of populism is fed much more by inaction on the part of centrist politicians and policymakers. Inacting to not solving the burning issues at stake. To exemplify what I am saying here, I would cite the two other core topics of our conference, the demographic shifts and the digitalization of health. The demographic shifts offer a good example on the inaction of democratic institutions. Or allow me the question, who in the room here is convinced that centrist politics are successfully dealing with the enormous pressure of nursing and long-term care for our aging population? Who is convinced that we have implemented good programs and answers to mobilize the potentials of the migrant population for our labor markets, regardless of the needs in the tech industry, for example, or in our health and nursing sector? Who is convinced that we have the right and successful programs implemented to address all the wide and varied issues of mental health, especially in our urban centers? I could go on and on, but here is what I want to emphasize. These are topics upon which we as healthcare leaders can act and to which we can find solutions. Let's overcome our inaction and stop just talking about problems without operationally solving them. Believe me, the populists will soon start throwing this topic in our face and tell the people how incapable the democratically legitimized decision-making process is in solving the problems of our parents' and grandparents' generation. Wait for it, it will come sooner than later. The regulation on digitalization is a positive example of acting. The new European legal framework for the health data space not only protects data privacy and data safety, it also clearly states the right of patients to have their health data used in a meaningful way in primary and in secondary use. Please think about it. It is my democratic right now to have my health data be made available not only for primary use during and after my treatment, it should also be made available for secondary use to enhance research and science for the benefit of the next generation of patients. To conclude, my friends, I wish us all a thoughtful and meaningful conference. It's in our hands to keep the shifting sands from blowing over our heads, suffocating our freedoms, and the quality of healthcare and long-term care. It's up to all of us to act and to leave inaction behind us. Doing so can be our very important and meaningful contribution to letting democracies, freedom, and the human rights thrive, rather than be jeopardized by populists who are just waiting for us not to deliver. Thank you very much, and I would love to hand over to my dear friend and Vice President, Professor Ilona Kikbusch, to start the podium.
Thank you, Clemens, and thank you for the reference to my name about kickstarting the plenary. I'd like to welcome all of you very much to this discussion on democracy and health that we will have in this panel. And we will have 2 rounds of discussion with the panelists. We will have input from Floris in between with some cartoons. We will also have a short message from the regional director of the European Office of the World Health Organization. And I hope we will be able to leave you with some points to think about. We're obviously not going to resolve the issue of democracy and health in this panel. We will hear different views about it. We will hear from some of the research that's been done. But I would also like to ask you to go back to the facts and figures in the document, The Healthy Europe, that each of you got. And if you want a shock in terms of facts and figures, the Economist Democracy Index says that only about 8% of the world's population lives in a full-fledged democracy. 8%. You can reflect if you are one of those 8%. And the issue around the flawed democracies that comes with that relates exactly to what Clemens was speaking about. You know, how can we address the issues, and what role does health play in order at least to move from the group of the flawed democracies back into the group of full democracies, because the number has been going down. So this is something that we will be taking up. We have a wonderful set of panelists, and I would like to ask them to come up and join me. First of all, Mr. Donis Kordesh, the State Secretary, Ministry of Health of Slovenia. Then Andras Tivadar Kulja, who is a member of the European Parliament. I'd like to call on Pamela Rendi-Wagner, who is the director of the European Center of Disease Prevention and Control, that many of you here in Austria will know well. I'd like to call on Nathan Mani, lecturer in inequalities and global health policy, University of Edinburgh, and on Gloria Hequier, who is advisor to the Belgian Council Presidency, Cabinet of the Deputy Prime Minister of the Belgian Federal Government. And last but not least, the person who's going to give us some data, Scott Greer, who's Professor of Health Management and Policy of Global Public Health and Political Science at the University of Michigan. But again, many of you know him through his very close association with the European Observatory on Health Systems and Policy. So a welcome also to all of you, and thank you very much for coming here and joining this panel. So without further ado, I'd like to come to you, Scott, because you're going to give us some background. And in the pre-discussion, we had said it's very interesting. We've spent a lot of time also here at the European Health Forum Gastein talking about the economic case for health. and investment in health and everything that comes with it. And we thought that economic data are going to change the political choice for health. We were wrong. So the interesting thing now is you say we should actually make a political case for health. And maybe, that could scare some politicians into action. So we thought we'd hear from you how your latest research suggests that in a very concrete and tangible way, health status shapes democratic participation, and that health, if one looks at those data, actually seems to become a decisive issue in democracies. Could you share some of those data with us, please?
Yes, and the new research that Ilona so graciously referred to as a policy brief just out from the observatory today, really, that you'll be able to get online. And it's really exciting because this is research that we couldn't have done 10 years ago. It tracks individual level behavior. We're not talking about places, we're talking about individual people. And there's two findings. One of them is that ill health reduces political participation. The other, possibly more shocking, is that ill health leads to a substantially larger likelihood that you're going to vote for whatever your local populist radical right party is. The AfD, Rassemblement National, Vox, vote for Brexit in the United Kingdom, for example. Moving from self-reported fair to poor health makes you about 16 to 20% more likely to vote for the populist radical right. What's the mechanism? Why does becoming seriously sick seem to lead to this change in political behavior? The answer is trust. People whose health status gets worse tend to lose trust in the healthcare system, the political system, elements of society at large, and they tend to lose a sense of agency, and they tend to deal with it by becoming more likely to vote for the populist radical right. It doesn't affect their electoral choices otherwise, but it does make them more likely to vote for the right. In other words, it is mathematically possible that the number of people in the United Kingdom whose health status deteriorated as a fairly clear consequence of the Cameron government's austerity budgets, and who therefore voted for Brexit, is larger than the Brexit victory margin. The stakes, if you're an elected politician, are really high. There isn't just an economic case for health, there's a health case for health.
Thank you very much, Scott. And if I can say, rather scary data. We had quite a discussion on this in the preparation. Are there differences in terms of generations and sexes and whatnot? But on the whole, these data seem to hold. And we urge you to look at them and to see how they will be reflected for your own country and for your own work. I'd like to turn to you now, Gloria, for a member state perspective, and particularly in light of the recent Belgian presidency of the European Union. And of course, what Scott has referred to relates to the social contract. What can we expect from the state? And is the social contract in Europe, is that changing? What experience did you have in the discussions during the presidency, and how much is health seen as part of that social contract, which is actually a pulse of the democracy in our part of the world?
Yeah, thank you. Maybe I'd like to start off from a very concrete experience. I participated in the European elections last summer, and of course, we also struggle in Belgium with this populist movement, with the extreme right gaining traction. And it gains traction, of course, over this idea that nothing is working anymore. I think that's the central idea. And my experience, and the experience of my party also, is that you cannot go to people and promise them that you will solve everything. That's not possible. But you should always have like 3 or 4 concrete measures up your sleeve that are tangible, that people really care and feel strongly about, and that you can solve, right? And this is how we went about this presidency also, where we, of course, our health systems are under incredible stress because of austerity, surely, but also because of the aging population. Our health budgets right now, they are growing naturally. We are not reducing the money that we spend to health, but it's just what we are giving to it is not enough. That's more or less the situation, if I put it simply. And we need very strong long-term reforms in our health systems. They will not look as they have done in the past 20, 30, 40 years. That's not possible. But then at the same time, you also need to go to people with a few concrete things, right? And so what we put on this European agenda, first of all, is the medicine shortages. Because I assure you that a lot of people care about medicine shortages, and even young people are being confronted with it, where we managed to establish a solidarity mechanism between countries to exchange medicines, of course, and also to establish a critical medicines alliance with governments and industry and patient organizations to work on long-term solutions. That's a success story. Another thing that we put on the agenda is the crisis in the health workforce, which is not a European topic per se. But if Europe does nothing, then the poorest and the most rural areas will be left behind, because we know what happens. There's a shortage and the skilled workforce goes to the richer regions. That's a really big challenge. And so in order to deal with this crisis, you need to reform to a certain extent the professions. And there we need to learn from each other. We will not be able in the future to have a patient and a nurse, and the nurse does everything from A to Z. This is not the nursing profession of the future. But then what it will be people with different skills working in teams, right? That's at least how we look at this. But there you need to exchange with European countries, with European partners, and there's even a link with the Professional Qualifications Directive. Europe could be immensely beneficial to us, to member states, in this brainstorm, in this task, because no one has the right answer. It's a structural challenge, but no one quite knows what the golden bullet is, right? And so there, again, it's a great European topic, but for now, it's not taken on board in the political guidelines, so I do count on the next commissioner, maybe. And the third one is prevention. Now, prevention is not always a popular topic. Most people tend to like alcohol, which is very sad. Well, it's very fun, but it's also very sad for our health systems. But then again, there are also a few topics which are, in fact, actually quite popular, like going against tobacco is quite popular. And healthy food is also a very popular topic. And here the EU has real leverage. For instance, the Nutri-Score is a great thing because people cannot read the back of the package, right? But they do want to know whether their food is A, B, or C score. And so these are things that I believe are great topics for Europe, because Europe most of the times struggles with the fact that they need to speak directly to people. And I believe in the health sector there are a great number of topics where Europe could grasp the opportunity to speak directly to people. And yeah.
Thank you, Gloria. A little bit too long, so a message to the other speakers, but a very important message. Be very concrete, take up issues that are relevant to people's everyday life, where they really feel the impact. And I just like to remind us of the three: the access to medicine, the access to care, and the access to prevention. And that later point, the third point, leads us right to Nathan, because you say people have a feeling, things are not working, but it seems for some people things are working very, very well. Because, for example, the food industry that you referred to is bringing in enormous profits right now. And so, we have a great imbalance also within the European Union and the policy decisions. And there are tremendous pressures, obviously, from this industry on any political decision related to its products. So, Nathan, Clemens just referred to a new group of diseases, the commercially induced diseases. So what can you tell us about corporate influence, and what diseases are these?
Absolutely. Thank you for that. I think this is one of the fundamental questions we face when we think about what kind of future we envisage, right? When we think about a future that's inclusive, that's healthier. We're not just thinking of a future where treatments are more available to those who fall ill, but we're thinking of a future in which fewer people are ill in the first place. Like what Martin Luther King said, true compassion is not about tossing a coin to a beggar, but understanding that a system that produces beggars requires restructuring. And so inevitably, as part of that restructuring, we will contend with forces, powerful forces, that are in opposition. It can be very tempting to say we need a whole-of-society approach when it comes to reducing emissions, when it comes to reducing costs of healthcare systems. But when the whole of society, if that is interpreted as including the tobacco industry or including fossil fuel lobbyists, then actually that progress will be dramatically slower. And what we now have quite a lot of evidence on is that where there is a strong contradiction between health and profit, so to go to the example of tobacco you used, a study in England a few years ago estimated that around 70% of revenue for alcohol companies are coming from about 20% of consumers, right? So that reflects that as an industry, they are disproportionately reliant on those who are harmed the most. And if everyone was to drink at government guidelines, they would lose around 40% of their revenue, right? So we're dealing with fundamental conflicts of interest. And what we know is that these can be expressed and influenced to policymaking in a range of ways. Direct lobbying, lobbying through trade associations at the EU level, legal threats, funding research that disputes causation. And I think I would just close by saying these are not simply problems of siloed health policy issues. These are interventions that have a cumulative effect, a cumulative polluting effect that goes back to our issue on democracy. If lots of these interventions are disputing the role of the state, emphasizing individual responsibility, seeking deregulation, funding parties that emphasize deregulation, that has a cumulative effect for all of us, not just in health, but in wider democracy.
Thank you very much for that. And of course, we are all used to these debates about the famous or infamous nanny state, or the parties that want to take all joy in life from you. And I come from a part of Germany where the Weisswurst is very popular, and the premier of that part of Germany has associated that with ultimate happiness. So I think we're up against a lot if well-being is now dependent on sausages. But I'd like to turn to Pamela and get serious again, even though this is very serious how the debate is being played out as a populist measure. Pamela, of course, there's a lot of discussion around the role of the ECDC, how it can better protect and promote citizens' well-being, and sort of go forward in safeguarding health and building trust in the European Union. If the ECDC works, we actually get a feeling that the EU is doing something sensible. But I'd actually like to focus with you on something that you were also discussing this morning at the press conference, and that links to the other D in our discussions, partly the digitalization and all of that. And that's the issue also of misinformation, and how, you know, all this kind of debate and these kind of issues that have been raised, you know, sort of move through society in a very destructive way for the health debate, for health professionals, and for public health organizations. Would you say a few things on that, please?
Well, I'm very happy you put on, or at least you take the trust in the focus of my question, and it was also Scott mentioning trust as a very important factor and issue when it comes to public health, promoting health, and being trusted public institutions. Well, the challenges during the pandemic were huge, but let's focus on the one you want to discuss right now. And I think one reason for decreasing trust during the pandemic was also, there were many factors, but one was that, as a matter of fact, we had a really fastly changing state of knowledge. This is something normal for a scientist. We are happy if knowledge is increasing, and what is true now might not be the case tomorrow. So for us, this is just a normal concept of science. But for the people, it is not. For the people, steadily changing information and recommendations based on this evidence may create a real state or sense of uncertainty and fear. And this is a problem, because uncertainty and fear is maybe the best breeding ground for disinformation, misinformation, fake news. And actually, this also happened during the 3 years of COVID-19 pandemic. So how to tackle? I think we have really, really much more to invest in awareness initiatives, raising awareness in the population, just trying to teach them the concept of science, the concept of evidence and knowledge. Because knowledge and evidence is never constant, it's dynamic. And this has to start at schools, and even at the medical schools, universities. Medical students sometimes have no clue about that, you know. So I think we have to be much more active to tell them the concept of science. But secondly, I think it needs a clear and understandable language. And in particular, when it's about crisis communication, we need a communication and a language of the people. We have to speak as not only health politicians, but as scientists, you know, giving the evidence and recommendations for the people with regard to vaccinations, lockdowns, whatever. Speak the language of the people, be clear. Don't hide behind the language of science. This is a very tricky thing, and we scientists feel so safe in our safe space of science and bubbles. But no, we have really, if we want to reach people, we have to speak their language. And when it comes to mis and disinformation, I think it's very, very important. Like with any other newly emerging virus, we should be very quick in detecting the virus in order to be able to respond quickly. And the same regards for dis and misinformation. The quicker we respond to it, the more success we have, and the less it will distribute quickly via social media, digitalization, as you mentioned, Ilona, before. So what we did in concrete, just to give you an example, at the ECDC, as a consequence of this mis and disinformation during the pandemic, we initiated, well, we're still in the implementation phase, but we initiated a project called social listening. So social listening aims to collect dis and misinformation in the social media at a very early stage. It also includes some AI functions, and it has an alert function as well, to give us as soon as possible an alert when there is an increase of a certain amount of misinformation, in order to prepare in time with science-based counter arguments. So what I want to say, everybody's talking about preparedness, to be better prepared for the next pandemic, and they only refer to infectious disease monitoring systems, surveillance systems, digitalization of surveillance. But I think at the same level of the same level of importance, we have to regard issues of trust and communication when we talk about preparedness, because the next pandemic will be there. We don't know when. So every politician now in power hopes it will be not within the next 5 years of his or her period. That's why they don't invest too much in preparedness, and this is the sad information about what's going on right now. But I think trust and communication should be a very important pillar of preparedness for the next pandemic.
Thank you, Pamela. And we see that more and more organizations are working on these issues. The WHO has started a new trust initiative also along the lines of what you explained. You can find on the web really interesting data from all around the world in relation to this listening project. Heidi Larsen runs the listening project, and we will also take up the results in a discussion at the World Health Summit that the Forum Gastein also works with. But I'd like to continue on this with you, Andras, because there is this increasing discussion of the role of big tech in the context of building trust, about the influence and particularly the polarization within digital spaces. And of course, what we have learned during the pandemic, and which has really been difficult to contend with, in the past, health was an issue that connected people. Everybody wants health. And suddenly, health is an issue that divides people. And it's very much also in the digital space that that is created. So share with us some of your thinking, also, of course, from the view of the Parliament and your experiences there.
Yeah, we all see how big influence have the digital spaces on people's opinion, and how and it can influence, and that how they think about their health and health-related questions. We could see during the pandemic, as Pamela mentioned, that. How the spread of misinformation, how fast can be, and we have a disadvantage because the science is much slower. We cannot say this is true or this is the solution, because we must test it, and we must be sure that our answers are science-based, and it is, to me, the health communication is very important, but because we see that there are more and more new treatments and preventive vaccines. But the skepticism is growing, and we easily can find ourselves in a situation when we have the treatments, but the problem is not the availability of treatments, but the skepticism and the willingness. So we must deal with these questions, because as Scott highlighted, the state of healthcare, people's health, have a big impact on our democracies. And we all see that extremist parties have to try to take advantages. It was a shocking experience in an MV committee to hear the extremist MEPs to talk about sorry, I try to be polite about crazy things. I will say this word, for example, mentioning instead of sending treatments and medicines and vaccines to Africa, instead of that, we need to promote natural immunity. So my answer was that 200 years ago, the average lifespan of a European citizen was 36 years, now more than 80. 100 years ago, the infant mortality rate was 16.5%. This is what the natural immunity means. But we must talk about this. We must find the new methods to reach the people. And I think ECDC has a great campaigns, and it is why I started my educational TikTok channel. And the fact that now I have more than 300,000 followers is not because my channel is so super cool, but because there is a big need for information, for easily understandable and evidence-based information. So we must deal with these questions, and we had great discussions with other MEPs that in this new mandate we must pay more attention on the health communication, because I think it's part of the prevention, and it must be a part of prevention strategies.
Thank you very much. So you have 300 more followers now. But I think you've raised one thing that I also want to take up with Dennis. And that is the fact, when we talk about democracy, we talk about discussion, we talk about discourse, we talk about, not just thinking we're right or wrong, but that we might have different positions, and that, at some point we find a democratic compromise. But we also seem to discuss that it's difficult to define what actually is the role of a citizen. And what I wanted to ask you, Dennis, is, do you have a comment on that? Because being active in a democracy means not only voting. It means being active in your community. It means, being maybe active on social media in a discursive way, etc. What's your experience, what's the experience in your country of what some people call a vibrant democracy, which means that citizens are part of it and don't just go to vote maybe once every 4 or 5 years?
Well, yes, well, thank you. I think that people in general have not forgotten how to be a good citizen. I come from a healthcare background, and I can tell you that in Slovenia in particular, the people is very loudly and directly expressing their feelings about the public healthcare system and in supporting it, of course. So I believe that people in Slovenia, and I mean in the European countries, still believe in solidarity when it comes to the health. Like I said, in Slovenia we have directly expressed people to support public healthcare system, and why? Because it will ensure the accessibility and quality of care for all, so including the most vulnerable groups of population. So, like I said, solidarity and equality remains a key value in this area. Of course, as many of you already stated, we also are facing a trend of distrust towards politicians, towards government. What is even more worrying, it's towards healthcare system, healthcare workers, and even towards medicine. So this is a concerning problem. This is reflected the most in primary healthcare, which in our system is, of course, it's traditionally good and very important pillar of resilience. As in other countries with the strong primary healthcare, we are since COVID-19 facing a burnout and shortage in healthcare workers in primary healthcare, and at the same time, the people with ever-increasing expectations, not always needs, expectations, and it's also a problem that has to be attained to. So patients are in addition often misled by the information they get on social media, and which contributes to the overload of work and jeopardizes trust. So the question is how to best address this. We have some good experience from cooperation with non-governmental organizations and civil society in general. The inclusion of representatives of patients with diabetes and those with cancer in the ministry working groups responsible for national programs in this area has had some very positive results. So on the one hand, the patients contributed with their experiences so that the decisions made were more consistent with their actual needs. On the other hand, empowered patients who participated directly in decision-making contributed to greater trust in decision and in healthcare professionals among other members of their association and beyond. So as an example, I can present the cooperation with organized patients with diabetes that led to transfer of the education of patients to the graduate nurses in the family doctors team in healthcare centers. The involvement of patients, their clearly expressed interest, contribute to that change and previously was seemed unfeasible because the profession did not see it as a priority. So patient organizations also ensured that the change was not perceived by patients as limited access to the specialist. Of course, it should be emphasized here that the Patients Association in Slovenia are co-financed by the state, which enables them sustainability and independence from the industry, and thus their more consistent focus on the patient's interests. In short, trust between stakeholders, politicians, practitioners, and people is and will be even more crucial in the future for democratic decision-making. We believe that collaboration, inclusion, transparency, and working together can lead to trust and democracy in general and in health. We see systemizing and institutionalizing of social participation as one of the potential solutions that could contribute to the actual resilience of healthcare systems and their transition based on democracy and trust.
Thank you very much for that and showing us sort of it goes in both directions. You know, whether you're in good health, you know, seems to influence your voting behavior and your position. But on the other hand, within health, you can practice democracy. And that in itself can perhaps overcome some of the issues that Scott referred to, that not automatically, if you're ill, you vote for a populist party, but you actually, I'm being simplistic now, participate in a patient group and help to change the healthcare system. But you indicated one thing that I think is absolutely critical. If you participate and you make recommendations, you expect change. And if you participate and nothing changes, then you lose trust. And one of the most disappointing things for me was, you know, the big citizen participation in the European Union, where I forget exactly what that process was called, which actually put health very, very high on the agenda. And then, you know, the politics, the policies of the Commission came out and, you know, said, where's health? Where's health? And I wonder what those citizens who spent a lot of time and effort to contribute to this process throughout Europe felt about it, and that's how you lose trust. So we now hear from the regional director of the WHO, Dr. Hans Kluge. I guess the film is ready.
Dear colleagues and friends, good day. It's a common perception that the world today is less safe, more unequal, more partisan, and driven by unaccountable commercial interest than in the past. Growing dissatisfaction with traditional political systems and institutions, magnified further by disinformation, is a threat to the very fabric of our societies. This has obviously enormous implications for our health systems, which is why the tagline of Gastein 2024 is so appropriate: the shifting sense of health. And it is why I, along with Minister Riina Sikkut of Estonia, last year hosted the high-level talent conference on trust and transformation, resilient and sustainable health systems for the future. Trust is a complex concept to navigate. But let us be clear, trust is the foundation of our health systems. Without trust between patients, health and care professionals, and those who run our health systems and take decisions about them, we have an empty shell. Healthcare providers are leaving the professions across Europe due to the sense of burnout and not being valued, neither by politicians who treat them as a resource rather than as individuals and professionals, nor by the general public. To bolster trust is crucial. Taking action on pervasive practices that undermine trust, such as informal payments for healthcare, waiting lists, outdated service delivery models, and corruption. At the WHO Regional Office for Europe, we are going to the Regional Committee next month with a renewed vision for health systems, which puts trust at its heart. We need to strengthen our systems to make them more resilient and sustainable, and we do have the tools to do so. Here I would point to the European Observatory's practical handbook on resilience testing and the WHO Global Health System Performance Assessment Framework. But without first engendering a climate of trust among stakeholders. What use are tools with no one to pick them up? As such, central to this new vision is to build on the concepts of social participation and the economy of well-being. Citizens' assemblies and strategies of co-creation with health and care professionals are concrete examples of ways we can include stakeholders and regain trust. And I'm very committed to these in the new vision. We are, as the saying goes, only as strong as our weakest link. I put it to you, ladies and gentlemen, that for the moment, trust represents that link, and we must all work to strengthen it. I thank my very good colleague and friend, Dr. Clemens Ohl, and the forum organizers for the invitation, and extend my deep regrets for not being able to join you in person this year. My best wishes to all.
Let's clap. So thank you to Dr. Hans Kluge and, of course, a number of important staff from the European office are here for you to discuss with, and you've heard from them on other panels already. So, Flores, what impression did all of this have on you? So, thank you. Well, the tombstone was definitely a bit worrying. Here lies trust. So let's go to you again, Scott. What are the implications of your research in terms of policymakers or political actors, or however we want to call them? What do you read from that research? What actions are needed?
Well, if you are of the populist radical right, it's a good business model. Enact policies that don't make people healthier, and then when they get sicker, they vote for you. So it's okay if you're one of those parties. If you're not in that political family, well, The first one is this is a new reason to care about health status. It's not just that people will retire later or all of the arguments we've been making. It is literally better health leads to different political behavior. And I think that's a message that will capture the attention of your average politician. Then there's also things you can do. Look at the mechanism, it's trust, right? Learning that you have diabetes does not automatically make you start watching conspiracy theories on YouTube. What happens is you become frustrated with the healthcare system, with your employer discriminating against you, with benefit systems. Things happen in the course of your disease that reduce your trust. And that's a thing that we can address. I was very glad to have the regional director raise the issue of informal payments and corruption, for example. Furthermore, most of the time, ill health reduces your political participation. People in poor health are less likely to vote. But you see increased political engagement among people who are members of strong patient groups. This research changed my mind because I've spent most of my time doing elite interviews in Brussels, and if you meet a patient group in Brussels, they have to prove that they don't work for a pharmaceutical company before you listen to them. Well, in terms of their impact on patients' trust in the system and political engagement and feeling of self-efficacy, patient groups are actually valuable, and patient engagement, like Dennis was speaking about. They actually help reduce the right-wing bias of people in ill health, and they also make them legitimately more trusting because they have more engagement with the system. And finally, there's a lot of ways in which improving health status and improving the way that our health systems and our broader societies treat people in ill health can lead through to a different and better politics. So it's not just a broad Chancellor Scholz improve health. There's also much more concrete politics we can do so that we don't systematically break so much faith with people in ill health.
Thank you, Scott. Andras, I'd like to continue with you, and you were listening very carefully and nodding partly while Scott was talking. And we heard from the other side of the panel that one way also to engender trust and move forward lies in the field of policy making and regulation. And the European Union has been leading in relation to digital technologies, for example. Why do you think it is, or what needs to be done that a similar willingness to regulate actually enters the health field, particularly the prevention and the commercial determinants?
Yeah, we see that the European Union has a very in the European Union, I think health now more important than before. The new commissioner is, we have some questions, but I think it's not the part of this discussion. And we see the new regulations, European health data space and medical device regulation. And I think it's sometimes the European Union's law, but it is very important to make much quicker, bigger steps in a harmonization and to streamline the different regulations in European Union to help to the member states to fight against these challenges. And I think as a newly elected MEP, I must put a very big attention to these topics, and we find those communication channels with other professionals and organizations like ECDC or WHO, with which together we can create a new policies and also to make this, policies more detailed and to implement them much faster. So I think As a newly elected MEP, to be honest, it's a very big challenge to me, but I try to be very active, and I see all the other members in the SEND committee and the MV committee very committed to do relevant and serious work on this field.
Thank you for that, and thank you for your commitment. I think we should thank a member of the European Parliament to be so committed to health and actually also help us. We already spoke about the mission letter that's being prepared here, and one of the things we've been discussing is, to actually support parliamentarians like yourself with a set of questions to ask, for example, the possible commissioners and to see what their answers are in relation to the kind of issues we're also discussing here at the panel. And the same direction goes for you, Pamela. I mean, there are great expectations in some quarters of the ECDC, and there's a mandate that has been strengthened. But do you still think that you have enough tools? Can you comment on that? Would you like to have, a little bit more power and in relation to the health threats that we are facing?
Well, thanks for the question, because as a matter of fact, as new director of ECDC, it can always be more. I mean, you will never say no to more tools, more empowerment, more possibilities for a better health in Europe. But I have to say, you mentioned the new mandate of ECDC. This was a consequence of the lessons learned from the pandemic. And indeed, this new mandate really empowers ECDC for our activities. It empowers us with regard to more international cooperation, because we learned during the pandemic it needs more, not less cooperation, even outside the European Union. So we have cooperation with the US CDC much, much more frequent and more intense now than it was pre-pandemic. The same regards, I'm signing a contract with the Japanese CDC next month, because it makes sense also to cooperate with the Asian CDCs. And the same regards for Africa's CDC, which is of utmost importance. Just think about Mpox right now regarding to the African CDC. So international cooperation is enforced. But at the same time, we are empowered also to connect more and more directly with the member states. And I think this is of utmost importance, because when we talk about trust, it's not only about the trust between the population and public health authorities or health politicians. It's also about the trust of the players, and the member states, between the member states, between ECDC as one of the leading public health agencies in Europe and the member states. So it's also a matter of trust. We have it's Article 7, so we do country assessments with regard to preparedness of the member states. So we spend, with a team of experts of ECDC, a week in the countries, working directly at looking into their preparedness planning, staffs, public health staff capacities, things like this. And this really brings us closer together. This is really very important for future cooperations in crisis situations. At the same time, we have this is very new, EU Health Task Force. This is totally new. So ECDC has the possibility, with a team of experts, to go directly and immediately to member states who ask for more support in the case of a public health crisis or preparedness questions. So we have much more tools to support the member states, to go into direct contact, to build up trust in the member states. And I think this is really important. But I have to say this can only work well if there is also engagement at the member state side. So it needs both sides. It needs us with the tools and the member states. So to make it short and to conclude, a new mandate is the right step, but it's just the first step. The tricky part is the implementation, and we're in the middle of the implementation. But if we really manage, and I'm very confident that we are able to implement this new mandate with more cooperation in Europe and beyond, we will be much, much better prepared for the next pandemic. This is definitely the fact.
Thank you very much, and I think that's good news. And there are different calculations when the next one will come. And but definitely, you know, having a well-functioning, well-connected, globally connected ECDC will be an absolutely critical factor. Let's go to Nathan once more and hear from you what kinds of solutions, Nathan, you would advocate within this context of a European Union and the tools available to the Commission and the Union as a whole to actually address the commercial determinants.
Thank you. Yeah, I mean, that's a big question. I think going back to the issue of trust, I think trust is a two-way process. It's earned, and when you have trust, then you have a responsibility to use it, if that makes sense. You know, and I think when it comes to commercial determinants of health, we both have the responsibility to use the trust we have to bear witness to the real forces that are shaping health at the EU level. And on the other hand, if we fail to do that, then over time our trust may be diminished. If we are treating patients and sending them back into conditions that make them ill, you know, that's not a very trustworthy exchange, in my view. And I think that this is particularly challenging because of the scale of NCD burden, for example, but also because of the scale of potential commercial influence over digitization, over access to data, over misinformation. I think there are real useful, I mean, the EU is really not just powerful for the EU, it's powerful for the world in setting some of the parameters for the legislative parameters around how to legislate on complex areas like health and human rights, digital rights, transparency, accountability, liability. I think when I look at some of the really fascinating work that's been done by WHO Europe in publishing a report on the commercial drivers of NCDs, in producing documentation, guides for how reporters can communicate more transparently on health, right? When I think about the WHO global report on commercial determinants of health, some of the toolkits around better governance, it makes me hopeful that this is possible. But I think it's also a real challenge that goes back to really the core of why we are in health in the first place, and not becoming too fixated on trust as an end. Like, trust is a means to the end, and the end is improving population health.
Thank you very much, and that also fits well into that preparedness model that we just heard about. The Global Preparedness Monitoring Board has also seen trust as one indicator, and that we must help to ensure in order then to be able to be better prepared in a number of special situations. You will have a plane to catch, I think, so we're a little bit over time, so if you at some stage have to get up, people will know that you're not fed up with this panel, but that you have a real reason to leave us. So I'd like to turn to Dennis and take up the issue of WHO. WHO, the World Health Assembly, actually adopted a resolution on social participation for universal health coverage, health and well-being. And your country played a major role in getting it on the road. And there's a person somewhere in the audience. There she is. Oh, you stood up because people clapped? Okay, stand up again, Vesna. In German, we say, Ehre wem Ehre gebührt. You've worked for a long time on social participation to get this really on the agenda. But back to Dennis, at the member state level then, these WHO resolutions kind of thing, who cares? Do you care How can it be implemented? What difference will it make?
Well, of course we care, and like you said, we only can do it because of individuals like Vesna and other colleagues, of course, because we feel the need, and Slovenia promoting the adoption of the resolution on social participation together with Thailand was in fact promoting one of the possible solutions to existing challenges that we are facing in our health system. So when through years exploring the potential of systemizing social participation in practice and having some promising results, we felt obliged to share this experience and knowledge with others. So resolution was promoted and then adopted at the WHO with a reason. We see WHO as an important platform to share innovative solutions and an organization that can provide technical support to countries that would want to further explore and institutionalize social participation. For example, in increasing health literacy in the population and in counteracting disinformation. We intend to work with WHO in this particular area and meaningfully involve patient organization, but also organized youth to explore how we could reach faster and better different parts of population in this regard, and other countries, of course, are welcome and should be engaged and explore how through social participation we could better address commercial determinants or preparedness on health crisis. So.
Yeah, thank you very much for that. So, you know, there's concrete examples how to do it. There's recommendations in the resolution. All member states supported this resolution. So I think we hope that many of you will actually take the trouble to look at the resolution, to take it to the powers that be, and to use it as an example, as a model for how to engage citizens more in health. Because it seems, according to Scott's data, that this can be a really, really important contribution to democracy. So let's end with Gloria and the European Health Union. So if we are looking at the situation in Europe with far-right activists and parties gaining increasing influence, do you think, you know, a well-functioning European Health Union would make a difference, could make a difference, and how should that be approached?
I'm always a bit doubtful of saying, like, yes, that's the solution against the far right. But for sure, what is very important is that the European Union is seen to care for people. Right? Our presidency slogan was care, prepare, protect. And I think that's a very important thing. And then maybe if I can make a remark on the new commission, it's very much centered around competitiveness, which I don't mind. I also care about competitiveness. I don't think that's wrong, but it's very abstract to people. And so if you leave all the other things, if you forget all the other things for the sake of competitiveness, then I think we do have a problem, because you cannot go on the streets and talk about competitiveness. I think that's not really possible. And in this sense, I would like to go back to what you said about the Conference on the Future of the European Union, but you also have all the Eurobarometers indicating that citizens really find health policy very, very, very important. And I think honestly, we owe it to them to be strong on health, also at the EU level, because we've been through a pandemic, people have spent 2 years in lockdown. We owe it to them to be serious about this department. And so I really hope that the next Commission will take this up also.
Thank you very much for that. Let's have a last look at some of the cartoons. Who's this? So we heard, we saw trust is a two-way street, and trust is earned. We heard from one of the panelists, and trust is the start of something. And I think that's a strong message we can also take from this European Health Forum. Gastein and Gloria referred to it. She said, the actors of the European Health Union, the members of parliament, the countries, the organizations, and the European Health Forum owe it to the citizens of Europe to work for health and to regain their trust. And I think if we take that with us for the rest of the days here and for the mission letter that we're going to work on together, then we can take a step forward and support both democracy and health. Thank you very much.